From the Mumbai studios of Republic TV, it's time for the debate.
Thank you for joining us on the debate. I am Niranjan and I'm filling in for Arnab Goswami, who will be back on the show on Tuesday. India has recorded 3.53 lakh cases, the highest globally in a 24-hour period since the outbreak of the pandemic in 2020. Tonight, as our forces fly in cryogenic tanks to carry liquid oxygen from different parts of the world, and as the government asks vaccine makers to reduce prices, and as governments ask hospitals to make oxygen plants mandatory, we have just one question and two debates on the show tonight. Debate number one. What are the solutions? What more should India be doing now? That's our focus at 9 p.m. and we have experts on the show tonight. At 10 p.m., Ridham Anand Bhardwaj will be joining us with the big debate on will and can our politicians come together? Even global superpowers are coming together and telling India, stay strong India. But somehow politicians are missing the big picture. Here are the headlines. Forces ramp up efforts to fight COVID-19. The Chief of Defence Staff has briefed the Prime Minister on the operations to fight COVID-19. Industrial strength used for oxygen manufacturing, steel plants fulfilling over 3,100 metric ton oxygen supply so far. Sources say the government has asked vaccine makers to make the doses more affordable. From the Burj Khalifa to the United Kingdom, the world rallying with India to fight the second wave. India convinces America to lift embargo on vaccine raw material export after the two national security advisors hold talks. Countries across the world uniting for India. But what about the parties back home? What about the parties fighting with each other? Can they shun politics in national interest? Well, there's no denying that the second wave hit us like a storm, like a tsunami. We were all caught off guard. Some steps have now been taken to mitigate the crisis, or a bigger crisis. But the fight has just begun and we still have a long way to go, with the next big challenge being the vaccination process. Some states already raising a red flag saying we may have to delay it. Now, is there a solution? What are the possible solutions? We look at all of that, but here are the top updates on the fight against COVID-19 so far.
The Oxygen Express has transported more than 302 metric tons of oxygen across India so far.
This is the 44 tons of oxygen, liquid oxygen, which has now reached to the Kalamboli station and will be moved to the other district, and most probably to the 2 tankers for the Mumbai and 1 tanker for the Pune.
Indian Air Force is airlifting cryogenic tankers from Dubai and Singapore. Industries are pitching in with oxygen supply to meet the growing demand as cases rise.
उल्लेखनीय है कि जो हमारी प्रोडक्शन कैपेसिटी थी वो खाली 7,259 है, 7,259 मैट्रिक टन पर भारत सरकार तथा सभी राज्य सरकारों और यूटीज की सरकारों तथा हमारी इंडस्ट्री ने मिलकर इस राष्ट्रीय आपदा के समय में इस पे बहुत मेहनत करके बढ़ाते अपनी इंस्टॉल कैपेसिटी से भी कहीं ज़्यादा पहले 8,000 पहुंचाया और परसों ये 9,103 मेट्रिक टन था.
But the crisis is far from over. The apathy and shortage of resources is still plaguing parts of the country.
और यहाँ पर कई कोरोना के पेशेंट्स ऐसे भर्ती हैं जो क्रिटिकल कंडीशन में हैं, उनको ऑक्सीजन की ज़रूरत है और बहुत सारे लोग यहाँ से इसलिए भी वापस जा रहे हैं क्योंकि यहाँ बेड नहीं मिल पा रहे हैं उनको.
And as the country gets into war mode, forces are stepping up efforts. Chief of Defence Staff General Bipin Rawat has briefed Prime Minister Modi. Western Command will aid Punjab government in setting up oxygen plants. Some states are back in lockdown mode.
Manufacturing, agriculture and construction activity. Rest all.
Everything will be shut down.
And remaining essential service from 6 o'clock to 10 o'clock.
And the next imminent challenge for all governments would be the vaccination challenge, as inoculation opens up on May 1st.
You can see the board it's temporarily shut because there are not enough vaccination available. Yesterday, the BMC Commissioner had announced that vaccination will go on now continuously because of the fact that they had received enough vaccination. But what we've seen is there's not enough stock coming in Mumbai.
As more and more state governments are declaring free vaccination, there's a demand for vaccine prices to be capped.
इस समय में जब सारा देश मिलके कोरोना की लड़ाई लड़ रहा है, मैं समझता हूँ एक तरफ मैं वैक्सीन मैन्युफैक्चरर से अपील करता हूँ कि एक तरफ वो खुद भी इस प्राइस को खुद ब खुद 150 रुपये पे ले आएंगे. पूरी ज़िंदगी पड़ी है प्रॉफिट कमाने के लिए.
Sources say central government has stepped in and written to Serum Institute of India and Bharat Biotech to lower the vaccine prices. But is there more that all governments should be doing to ensure the crisis is brought under control at the earliest? Let's debate.
And joining us on the show tonight are Dr. Hemant Thakkar, who's a cardiometabolic specialist, live from Mumbai this evening. Padma Shri Dr. Arvinder Singh Soin, Chairman of the Institute of Liver Transplantation and Regenerative Medicine at Medanta. Thank you, Doctor. Dr. Ravi Malik, Chairman of the Radix Healthcare, live from New Delhi this evening. Dr. Rajan Sharma, former National President of the IMA, on the show. Dr. V.K. Chowdhury, Professor Biochemistry, Delhi University. Keval Handa, who's the non-executive Chairman of Union Bank and former MD of Pfizer. And I'd like to start, however, with Dr. Tripti Gilada, who's an infectious disease specialist. She's joining us live from Mumbai, and a few days back, her video went viral. And we're not calling her on the show today because her video went viral. We're calling her on the show today because we want to start with some good news. Some good news because in Mumbai, we've recorded less than 4,000 cases today, and we see that as a positive sign today. And that's fantastic news, isn't it, Tripti? Dr. Tripti, isn't it fantastic news that somewhere across India, there is some bit of good news coming in. Maybe it's a start. It started with Maharashtra, the number of cases that were recorded. It's still a huge concern, but this is some positive news and some strength that is going out to all the healthcare workers, the frontline workers, isn't it? How did you react to the news this evening?
Yeah, that news definitely comes as a respite, though we still need to understand that even 4,000 for Mumbai is a big number.
Yes.
And for the hospitals, I think it will still take 2 or 3 weeks for the crisis to come down, because the people who are getting diagnosed, over the last week or in the next few days are the people who actually will require the hospital in their week 2 or week 3 of illness. So for the crisis in Bombay, it's going to take 3 or 4 weeks to come down. But for the rest of the country, we know that they were lagging behind Mumbai by almost a month and a half or 2 months. So we will have to wait and watch and really hope that they go down on their graph faster than Mumbai did.
Now, when we saw that video a few days back, Dr. Tripti, now, we've seen the worst of it during the first wave, and we've seen a larger number of cases in the second wave. Now, you've been in hospitals in the middle of it. Why don't you tell us about what's going on and how crunched our medical infrastructure is?
So despite all the ramping up of the health infrastructure during the first wave and thereafter, I think the second wave took all of us by surprise. We were not expecting such an enormous second wave, and that too at such fast speed. So yes, definitely, even in the city of Mumbai, we continue to be overburdened. ICUs are still not easily available. Fortunately, the city of Mumbai and most hospitals in Mumbai haven't faced the shortage of oxygen as much as the other cities and Delhi is seeing. But I think it will, like I said, it is going to take another 4 or 5 weeks for things to get more comfortable, both for the patients and for the doctors.
Right. I want to ask the next question to Dr. Hemant Thakkar, and you're in Mumbai too, Doctor. And you know, this trend of a downward slide seems to have come in once again after some amount of restrictions. You call it a mini lockdown, you call it a lockdown, you call it a stronger restriction that is in place in Mumbai and in Maharashtra. But is it paying off? I don't know. What is your observation?
No, definitely the lockdown has helped to slow the transmission. We were at 9,500 cases last week.
Yeah.
And we've steadily come down 8,000, 7,000, today 4,000. I used to have a waiting list of 140 people at each of my 3 hospitals that I work at. Now we are down to 50%. So there's definitely a shot in the arm. But the lesson that we have to learn from this is the government and the citizens are asking pharma companies to lower the prices of vaccines. The municipality is asking doctors to come out of retirement and work. People are telling them to give free PPEs. But what are you doing? I want to ask the common citizen. Ask not what the country can do for you, but ask what you can do for your country. Did you wear your mask? Did you sanitize your hands? Today, when the vaccination opened in Mumbai, I saw queues of people, cheek by jowl, with masks dangling on their ears, happily chatting, and these people will come back after 5 days and say, look, after I took my shot, I got infected. But the people who get infected, they get infected during the shot because they all conglomerate together. Where is your discipline, your distance, your mask? If the medical infrastructure has to bear the burden every time, we are anyway overwhelmed, as Dr. Gilada rightly said. The second wave is not a wave, it's an avalanche. And we have to take a leaf out of this book. History has shown us that the second wave is always worse than the first. And if you are not going to do what you are supposed to do, if you do what you did, you will get what you got. So I am appealing to every common man, even if you've taken 2 shots of your vaccine, please wear your mask. Please keep your discipline. Forget going to matches, weddings, rallies, temples, and all sorts of gatherings which are likely to spread. COVID is smarter than you think. COVID is always one step ahead. COVID wants to mutate. COVID wants to come back. Who's going to win? At what cost? So this is something which all of us have to think of. Mumbai has shown the way. We stopped the trains, we stopped the transmission. I hope we take a leaf out of that.
Now, let me tell you, Dr. Thakkar, we've been reporting from across India, and the ground reality is that in 70 or 80% of the cities that we are reporting from, especially when you go to crowded areas, when you go to markets, it's scary to say the least. People aren't wearing masks, forget about social distancing, forget about the precautionary measures. And then you have the government today telling us in a news conference, Dr. Soin, that you have to wear masks even at home. So here you are, in public people are not wearing masks, and we have a responsibility, all of us do. In our newsrooms we wear a mask, and the government is saying wear a mask at home. How do you deal with a situation like this?
There is a dichotomy there, obviously. The fact that Dr. Paul said you should wear masks has actually confused a lot of people. I can't see where he's coming from. Because a lot of us, especially frontline workers, who get out of the house every day, so it would be prudent for them to wear, especially if they have comorbidities. They have family members who work, frontline workers in each service line, and also as a habit. If they're wearing masks at home, if they're wearing masks every time they interact with anyone, then hopefully they will wear masks when they're outside.
Yeah. And I want to bring in at this point Dr. Rajan Sharma. Dr. Rajan Sharma, while we were on the point of vaccines and taking forward what Dr. Hemant Thakkar just said, how can India, which is starting its third phase of COVID-19 vaccination starting the 1st of May and opening registrations at the COVID websites and the different portals on the 28th, ensure that a third vaccine phase deters a third wave? And the reason I'm asking you this question is, Dr. Sharma, we had the Bharat Biotech chief on the channel over the weekend, and he spoke about how, we vaccinated those above 60, those above 45, we will vaccinate adults. But he also spoke about how it is important for us to also look at the possibility of vaccinating children because they could be potential carriers. Now, what are the challenges on the vaccination front that you see, Dr. Sharma?
Is Bharat Biotech going to... Sorry, I am a mild case of COVID myself now, after being vaccinated with Covaxin. So that's the reason for my hoarseness of voice. But tell me one thing. Who is going to vaccinate? Last year when I was the president, the moment the Prime Minister announced, we offered free of cost 350,000 members from 1,745 branches to vaccinate people across the country without charging any money. But now, the concept is, I talked across the country. They said, sir, the cashier, they don't have cashiers because 150 rupees are the service charges even in private hospitals. The 100 rupees which we get, we are ready to waive off. It's a national crisis. We as Indians have to stand together. And why these double, triple, 3-time pricing? And I must put it on record, and we discussed that by being a 5 trillion economy, trying to being a 5 trillion economy, we are short of oxygen. Hospitals are closing their gates. I can say of North India, I cannot say of South India or across it. But they are closing their gates because of lack of oxygen. They are pleading with the authorities, please, half an hour left. You must remember and remind the public, I'm not creating a scare, but this is the way the healthcare has been handled. Everybody knew of a shortage. 90,000 90,000 liters of oxygen was exported last year. Why? We have now announced, chairman on record says, that we have enough of oxygen. Industrial oxygen has a very simple procedure so that we can convert it into medical oxygen. Announced chairman says we have enough of oxygen. Naveen Jindal today said we have enough of oxygen, but there is no trucks, there is no transportation. And at the end of the day, who gets beaten up? The hapless doctor who has no role in it. Where is Remdesivir? Utter disgust with, I am saying, where is Tocilizumab? It is being, WhatsApp universities propagating everything. There is no scientific data. A few days ago, ICMR came out with it that Covaxin is the best vaccine, and now we are offering Covishield at these prices. Don't you know what is the sentiment of the countrymen? They will not even go to Covishield. We as doctors know Vaccine is important. Everybody should get it. Covaxin, Covishield is more or less the same. But if this is coming from the government, I am sorry, we are going the wrong way.
Let me get in.
Putting it on record. The the Niti Aayog vice chairman says, I have never visited a doctor. For mild cases, eat, have Chawanprash and haldi milk. I have never visited a doctor. You decide. Ayurveda, I respect. Keep it aside. People are running for Remdesivir from, which is 800, we have priced it to 45,000. For Tocilizumab to up to 2 lakhs.
Yeah.
People are flying to the black market here. 15 to 20,000 of oxygen cylinders, and what are we debating?
That is why, Dr. Sharma, I can tell you, that is why we are having this discussion and not even a debate, because we are trying to find solutions. Because even the people who are watching this show...
There is no solution, sir. Everybody is with a begging bowl in front of the central government. You tell me anybody. I am talking to doctors across the country who say, हमारे पास ऑक्सीजन के सिलेंडर नहीं आ रहे, हमारे पास रेमडेसिविर नहीं आ रही है. People are so educated now because of the social media. They are asking it.
Yeah.
Every state government is a begging ball.
So that's why, you know, on your question of vaccines, I want to take that forward to Mr. Keval Handa, because he has some expertise in this area, in the pharma business.
Sir, I want to tell you one thing very frankly. First, talk of the current narrative. Don't go to the vaccine. You have people on two people on one bed sharing a mask for half an hour each with low pressure oxygen. Jaipur Golden, 20 people lost. Gangaram, 24 people lost. People are closing their hospitals. They don't want to take patients.
What's the solution? What's the solution, Dr. Sharma? That's why we're having the show. What is the solution? We've come to this.
Solution, sir.
We've come to this.
Deciding factor and
y'all are the experts. Y'all are the experts. Y'all are the doctors.
Everybody knew. Everybody knew the second wave was coming and it would be more lethal.
Yeah.
It would have been the government. It is for the health minister of the country to decide, answer this question, not me.
Yeah. Okay, let me put that question to another doctor. Let me put that question to another doctor. Dr. Chaudhary, you want to take that question? What's the solution? Now, okay, I'll give you one development that has happened today, and maybe you can take that forward. There is one state government which has made it mandatory. There is the Haryana government which has made it mandatory for hospitals to have oxygen generating units. They've made it mandatory now. The government has announced this evening at around 7 p.m. Now, my question, Dr. Chaudhary, to you.
4 months to install a oxygen generating unit.
Yeah, that is what I was coming to. That is what I was coming to, Dr. Sharma. My question to Dr. Chaudhary: should this have been done a long time ago? Dr. Chaudhary, I want to hear from you.
So
we had trucks.
I'm not a clinician, but you know, having seen all this for last 15 days, and having seen my friends, whole families down with some 29 people in 7 families we are taking care. So today I thought I'm here to talk about vaccine, but actually the solution was told by Dr. Thakkar.
Yeah.
There are multiple solutions. One is at the government level. None of us can talk about that. We are wasting our time by talking. Okay, that the oxygen can be made available by government. If we keep talking for last 7 days, nothing has happened.
Yeah.
However, Dr. Thakkar has said the right thing. It is in our hand. We have to save ourselves from the infection, and we have messed it up by not. And every expert uses the word COVID-appropriate behavior. How the hell a common man understand what is COVID-appropriate behavior? It has to be broken down, as Dr. Thakkar, Dr. Soin has said today. मास्क पहनिए, हाथ धोते रहिए, भीड़ से बचें. कल हनुमान जयंती जन्मोत्सव है, मैंने अपने 700 दोस्तों को एक मैसेज भेजा है, कृपया मास्क पहनकर रहें, हाथ धोते रहें, भीड़ से बचें। टेस्टिंग सेंटर में जाते हैं 100 लोग होते हैं, वैक्सीनेशन कराते हैं 100 लोग होते हैं। मैं जब गया एक गवर्नमेंट हॉस्पिटल में 150 लोग थे वहां पर, मुझको डर लग रहा था, बट दैट वाज ऑन 3rd मार्च कि अगर इन्फेक्शन नहीं होगा तो लग जाएगा। 5 दिन पहले मैं सेकंड वैक्सीनेशन लेने गया, ओके, वहां पर लाइन लगी पड़ी थी उस जगह टेस्टिंग की। तो जो डॉक्टर ठक्कर ने कहा, अगर वो 15 दिन हम सब लोग फॉलो कर लें, पढ़ अनपढ़ सब लोग, लॉकडाउन लगे ना लगे, सब चीजें कंट्रोल में आ जाएंगी। बिना क्लिनिकल प्रैक्टिस के मैं कह रहा हूं, डॉक्टर ठक्कर ने यह बात कह दी। तो कहने का मतलब यह है संक्षेप में, इन समरी, that to control the infection is our hand. We should not get infection to us, and we should not allow any infection to go to others. Nobody tells us that if one person gets infected, if you are a medical professional, how you are living. Dr. Soin said it right. My son is an anesthesiologist. We have a duplex. He lives on 1st floor. For last 1 year and 1 month, we have met only half an hour a day, because he thinks that he can pass on infection to us. Okay, but everybody is not so careful. So we have to be careful. This is the non-pharmacological way of doing it. And oxygen, no oxygen, that doctors will take care. Doctors are dying. They're crying. But nobody can control the oxygen. Nobody controls the infrastructure. So we have to control ourselves. Don't depend upon the government. They will do what they are doing. So I thought, in the end, if the time permits, I will talk about the breakthrough infections which are coming in a very big way. So if the time permits, we should discuss about it.
Yes.
A lot of medical professionals are getting infected, actually.
Sir, you know,
despite wearing, Dr. Soin, despite wearing full mask.
Yeah. No, I was about to say, Dr. Chaudhary, that, you know, the citizen has just 2 defenses, right? The citizen has just 2 defenses. One, of course, you got to take care of yourself and ensure that you're masked.
Yeah.
Second is vaccinate yourself. Now, that is why, it's as simple as that. Now, on that question of vaccines, I just want to go across to Mr. Keval Handa as well. Mr. Handa, this evening, we got news of the government asking Serum Institute, Bharat Biotech, to lower the price of COVID vaccines, as we, of course, gear up to inoculate everyone above the age of 18. As of this minute, the price to the center is 150 rupees, but to the states and private hospitals, anywhere between 400 to 1,200. Is lowering the vaccine price a leap ahead in solving the COVID crisis? How will it help? Why don't you tell our viewers, since you know about the industry?
So, very good evening and thanks for having me here. Let me first tell you, the vaccines in India are at the lowest prices as compared to anywhere else in the world. That's first thing. Secondly, don't make such unreasonable demands on the manufacturers to lower the prices. Today, the vaccine cost is about 300 rupees. If you supply 50% to the government at 150 and 50% or 40% to the state government at 400 and 10% even to the private sector, 100, you are selling your vaccine at lower the price. I heard somebody saying, "Zindagi padi hai kamane ke liye." Are ye to band pad jayenge kal. You have to have a reasonable, practical solution to it. Globally, vaccinations are procured by the government under the immunization policy and subsidized to the countryman or the citizen at no price. The right approach should be by the central government and the state government to provide this to those who cannot afford at no price and pay from their kitty rather than spending money on advertising on non-value added things. We should be proud that a company like Bharat Biotech has an intellectual property of vaccine today. And if you want Bharat Biotech to continue in future and do more different vaccines for different strains, don't tell Bharat Biotech to ask them to lower the price. I'm making a very urgent appeal to you. It's a wrong strategy to do that. You don't kill the goose which lays the golden egg. You nurture the goose so that it continues to lay the golden eggs.
Well, thank you for that intervention, Dr. Handa. I hope that answers the question there. Let me go across to Dr. Ravi Malik. He hasn't spoken yet. Dr. Malik, when at the current rate of vaccination, you have about 2.2 million doses being administered per day. 30%, as of now, only 30% of the eligible population will be vaccinated fully by the end of this year, going by the rate, right? How can we assure 100 million doses per month tally and ensure that 80% of the country at least is vaccinated? Now, what's your take on that?
Look, I run a COVID hospital and I've been giving vaccination at my hospital since the start of this public health campaign. So I have given thousands of vaccine in my hospital. Plus I admit COVID patients also. I've been listening to your debates. I would like to address few of the questions which have been answered nicely by our senior colleagues, but I would also like to add something to it. Number one, with the current speed of vaccination of 25 lakh people every day, we are not going to achieve herd immunity of 60 to 70% by the end of maybe 2022, and it will be too late by that time. So we need to, number one, increase the speed of vaccination. We have good infrastructure, and we have almost 10,000 hospitals which are linked with Ayush and 687 hospitals which are linked with CGHS. They have already been roped in. And the only solution to this is to vaccinate 1 crore of people at least every day. That is why that is how we will be able to achieve the herd immunity. Right now, it is urgently required to increase the herd immunity as early as possible. So 22 lakh of vaccine is not going to help. That is number one. Number two, this can be achieved only by involving more of the private players. We can involve the clinic. We doctors are willing to give the free vaccination on at our vaccination centers without charging anything from the government. That is going to satisfy ourselves that we are following the Hippocratic Oath also. And we from IMA, I have been the secretary of IMA also, so we from IMA and all our bodies, we are willing to do that for the public, and I think that is the least what we professionals should do. So number one is that we should increase the vaccination rate. Number two, you asked a very pertinent question about pediatric vaccination. So as a pediatrician, I will also like to point out that there is no pediatric vaccination which is available on this earth. And that is a matter of concern to me, because in our country, 41% of the population is below the age of 18 years, and they are all vulnerable, especially with the new strain which has started putting up the tentacles onto the pediatric patients. So this time we have had almost 80,000 of pediatric patients in the second wave. So that is also a matter of concern. So we should immediately gallop to do the clinical trials on the children and to get the vaccine as early as possible. In the whole world, only Pfizer is making a vaccine, is manufacturing a vaccine which is effective between the age of 15 to 18 years. So that is a matter of concern to me. Now, the third thing. Now, since I've been running COVID hospital for last almost a year, now we are facing an acute shortage of oxygen. So I would like to point out, yesterday was a bad day. I will say it is a bad day when we have lost many patients in Jaipur Golden hospitals, almost to the tune of 25, and those who were admitted in tertiary care hospitals, and they have died because of oxygen. It is not only a big loss to the country, but it is also a shame to all of us that we have not been able to provide oxygen to these patients. Those who were admitted in a tertiary care hospital, not to talk of the people, those who are not admitted, those who are not getting beds, those who are getting oxygen at home, or those who are not accessible to that kind of care. So it is a big concern for us. I run a hospital, so every time we get a panic, sir, only 10 hours are left. My medical superintendent tells me that only 10 hours of oxygen is left. We are running from pillar to post. Although the government is doing a good thing, but still, it is very difficult. So I will like to put that data. That data they never lie. Daily's requirement is 700 tons. It is very important for your viewers to know Daily's requirement is 700 tons of oxygen. And they are getting only 335 tons or 350 tons, or maybe they have got 378 tons lately. Now, my dear sir, it is oxygen. We cannot afford to get even 1 kg less, what to talk of tons. So if we are getting 325 tons, we are in the scarcity of 325 tons of oxygen, then these kind of cases are likely to repeat. And we professionals will have a big, in a way, we are feeling ourselves very helpless that how we will be able to justify our profession for that matter. So this is what is happening on the ground. Now, besides that, I would like to take an opportunity from your channel, Prime Channel, to tell the viewers that please don't run after the remdesivir.
Yeah.
Remdesivir is to be given only to the patients who are admitted and those who are on oxygen, and that is end of it. Don't buy oxygen from the black marketeers. Please leave remdesivir, whatsoever action it is a weak drug, but whatsoever action is there, please leave this drug only for the patients who are on oxygen. So it is very important for us to understand the people are just chasing remdesivir for nothing, although the clinical trials have clearly shown that it is not going to decrease the death rate. It is only going to decrease the hospital stay by 2 days. That is it. So it is very important for us to understand. So from the ground, I think I have a lot of messages for the viewers, and I'm very thankful to you that you have given a good opportunity for me to communicate to the viewers on all these issues. So my 3-4 concerns are, number one, herd immunity should be built up as early as possible. We have a huge population of 138 crore of people, and under the backdrop of fact that our herd immunity is nothing. Maybe we have given about 14 crores of doses, but I must tell you, till today we have vaccinated only 1.5% of people. I'm talking of both the doses, the complete vaccination. It is nothing. 1.5% of vaccination is nothing. I don't know how come the people are confident they are not wearing the mask. What is giving them? And there is a syndrome called post-vaccination overconfidence syndrome, PVOC.
Yeah.
So the moment the vaccine came, probably the people have started thinking that we have won the battle and the corona is gone. No, I would like to say mask is not going to go anywhere for the coming 1.5 years. Please wear it. Not only for yourself, but at least for your small children, those who are vulnerable. And this virus, if it turns around to our pediatric population, with the kind of weak infrastructure we have, it is going to be a big problem for our pediatric population. So I think we should prioritize our issues, and we should try to raise the voice so that the government people should also see that vaccination drive is increased, oxygen is made available, and more of healthcare professionals should be roped in. Maybe we can rope in army. It is a kind of an extraordinary catastrophic situation where all of us should join hands to fight with this menace.
Yeah, you're in Delhi, and I know that nobody would know it better than you and Dr. Arvinder Soin, who are joining us on the show. I think, we've also asked our viewers to dial in and ask questions if they have on the possible solutions. I think here at Republic TV, let me tell you, Dr. Malik, taking it forward from what you said, you stressed on vaccination. We at Republic believe that vaccination is the only way forward. We've been saying it again and again. We've been saying vaccinate, vaccinate, vaccinate. We started a campaign called Vaccine for All in January. In January, people thought we were crazy to say when we said vaccine for all. But it's become a reality today, right? And let me, I think our first caller on the show is Mr. Ahanna, I'm just coming across to you. Let me take this caller and I'll come across to you. Shankar is calling us in from Bengaluru. Shankar, what's your question?
Yeah, my question is, why can't we have vaccine for all citizens of the country? To have vaccine for all citizens of the country, why can't we have a system wherein poor people who have got this ration card holders, they can get free vaccine. And people like I really can want to say that at least 40 to 50% people in our country will come forward to pay for the vaccine. So we can have a system wherein poor people with ration card can have free vaccine, and the rest can have vaccine in any part of the country, and all private hospitals should be asked to deliver such vaccines which cost at least 400 or 500 rupees. And I don't feel that any citizen in this country will be against that.
Dr. Handa, you want to take that question since it's not entirely medical? Keval Handa, yeah.
Question. I think what the government is saying, that 50% which the government is going to procure is going to be available to the citizen at zero cost. That's a free. So let's understand that very clearly. Now, 50% they said the states can procure or the private people can procure, and there also only the establishment which are industrialization establishment can procure. Some of these states have also announced that they will give free vaccines to their citizens. So therefore, by and large, all the citizens almost about 70% of the citizen should be covered under the free vaccine scheme. So I think this is not a question that we need to be worried about at this point of time. But more important, which a point I'm going to make is, how are we going to deploy the vaccines? You need to have an analytics in place to have the deployment of vaccine done in such a way where the areas where the COVID is very, very high, you will need to contain those areas. So deployment has to go in those areas. Otherwise, you will have a mismatch. Vaccine will go in areas where they don't need it, and vaccines where are needed the most will not come to those areas. So this is the analytics that we need to put in place immediately for deployment of vaccines. And we need to get the aggregators in place for imported vaccines so that a proper cold chain is maintained. And at the hospitals, these imported vaccines are available at a cold chain maintained, and then they are deployed and given to the patient. So I think these are the few things that we bear in mind, and then we will have these vaccines given, and there is no cost involved for a majority of the citizen.
Okay. Next viewer calling us in on the debate, Subramaniam from Hyderabad. Subramaniam, what's your question? Go ahead.
Yeah. Can I?
Yes, go ahead, please. Go ahead.
Hi, doctors. Hi, everybody in the panel. Good evening. My question is how we are planning, to make our population fully vaccinated, maybe in next 4 to 5 months. What is the plan? And how we are going to supply the oxygen immediately? Maybe in a span of another 1 week, we want to turn around the situation and sufficient oxygen, supply is maintained. So for that, we need to do very aggressive work, very proactive approach. And I don't think any difference between Covaxin and Covishield. I myself have taken Covishield, and despite traveling to different areas in the abroad, I'm still safe. Yep. So this is a myth.
Okay. Dr. Soin, you want to take that question, Dr. Soin?
Sure. So as far as the oxygen thing is concerned, the
hospitals as well as the government, both at the center and the state,
sure that there is redistribution. Apparently, there is capacity has been diverted towards medical oxygen
and the obstacles in the oxygen reaching the hospitals have been removed. So there has been a mismatch between demand and supply in terms of geography, and that is being corrected. And we hope that in the next 4 or 5 days, the oxygen will reach in a timely manner to wherever it's needed. What we need, though,